Hey guys, hope you are all doing well. You may be kind of curious about what the title of this video is concerning, so I'm just going to kind of just jump right into it. My doctor thinks I have valley fever, pretty positive that it is, but we're actually still waiting for the test results to get back, and so yeah, just still waiting on that. But pretty much what I want to do for this video is just kind of raise awareness for valley fever, I guess. Even though I'm not diagnosed with it quite yet, it's just the fact that I went to two doctors, or two urgent cares before my actual primary care physician, and I got mistreated both times, and I got put on medication that I shouldn't have been on. So it was actually fighting against the valley fever, if that's what it is, and then it made my symptoms worse. But pretty much, I guess I just want to go ahead and apologize for a few things. Which one, I do apologize that I haven't uploaded a video from the Rubik's Cube this year, which is the 5x5 and the mirror cube that I told you about. I actually got sick 3 weeks ago on the 8th of January is when this started, and Caitlin and I just got back from Iowa, which is when I proposed to her, and we got back on December 22nd or so, and so I've only been back for a few weeks, and then I got sick on the 8th, and then now it's the 26th, and we're still trying to diagnose my issue. There As I was mentioning, though, the reason why I'm making this video is because I just kind of want to raise awareness for valley fever, because I mean it's a lot. It's very similar to like having the flu or having the cold, just the same symptoms, and then a lot of times it just gets mistreated and misdiagnosed. So I'm just gonna kind of go through everything that I've kind of been through, just so you know exactly where I'm coming from, and kind of just see where I'm coming from, see where I've been, and I'm gonna do daily vlogs about my symptoms and everything in case you are going through something like this. Then we can kind of go through it together. If you have any comments about anything, obviously you can post them below. My joints are kind of hurting, so I shouldn't probably do any type of Rubik's Cube, and I don't really have the energy to do any type of videos like that anyways, because as you know, I do put a lot of effort into those, so I do apologize that I haven't been able to do that yet, and I just thank you for your patience on those videos. As you can see, I want to show you, I do have it planned. There's my 5x5, and then the mirror cube right there. So I definitely haven't forgot about you guys, and I'm gonna do what I can to get those up as soon as possible. Caitlin and I, as I mentioned before, we're getting married March 29th. I'm moving into our new apartment on Valentine's Day, which is only in a couple weeks. So I'm gonna need a lot of help, from family and friends to help me move. And then Caitlin, after we get married, she'll move in with me to the new place, and I just want to get better, so that I'm healthy and we could have our wedding without me being too sick. So pretty much, valley fever, the symptoms, I'm gonna go through the timeline actually first, which started on the 8th and the 9th of January, which was a Thursday. I was at work and I was just sneezing. I had a runny nose, and I don't normally sneeze too much. If I do, maybe once or twice, but I estimated about 30 times that day. I just sneezed after sneeze after sneeze, and it was just kind of weird, and so I kind of found out about, actually, no, that's next, sorry. So Monday, so this is Thursday, right? And so that weekend passed, I stopped sneezing, the runny nose pretty much stopped for the most part. But then Monday, the 12th, came along, and I woke up with breathing, chest pain, back issues, just aches all over, within my joints and everything. And then I kind of I actually called off work on the 12th. I missed work the 12th, 13th, 14th, and the 15th of that week because of the issues that I was having, and I called the insurance place that we go through. We could call like a doctor that's there 24/7, and so I kind of talked to them and told them what my issues were and everything. So what they did was apologize if I got the name wrong, all you nurses and doctors out there, if you're watching any of this, but azithromycin is what they prescribed me over the phone, and so I took 2 pills, and then 6 hours later, my back, arms, and my mouth started swelling. My lip was pretty swollen, and a rash on my back, and then my armpits, they got really bad too. And so I called Walgreens and I'm like, hey, this is going on, should I stop taking this? And they're like, oh, it shouldn't be an issue, just go ahead and keep on taking it. And I was like, no, that's probably not accurate. So so we stopped taking that. Okay, then on the Wednesday the 14th, I went to the urgent care that's right across the street from where I live, and I went in there with the symptoms of the cough, chills, fatigue, fever, sweats, headache, weakness, nasal congestion, nose discharge, sneezing, sore throat, shortness of breath, muscle pain, swelling, itching, rash, redness. And I, got the rash and the hives from the azithromycin, most likely. But at that time, we didn't know that I possibly have valley fever. So when I get misdiagnosed with other stuff, and then antibiotics don't do well with valley fever, so I'm learning. And so anyways, so at that time, at that day at the urgent care, I got released with a viral illness, supportive care recommended, fluids, humidifier, shower, steam, may start Aleve twice a day. I was prescribed an inhaler. I never bought that or anything, but he did go ahead and prescribe me to prednisone. So picked up some prednisone, and I took prednisone. Missed those 2 days, or those 2, because I went to the doctor that day. So, but anyway, so 1, 2, 3, 4, 5, 6. So 6 days of taking prednisone, which was to help me get rid of the rash. But also, come to find out, prednisone is really bad if you have valley fever too, because they fight against each other, and so it makes symptoms worse. So that was the second time I got misdiagnosed with antibiotics. And the reason why I'm making this video isn't to have like a whole blame game or anything like that. It's just I want more of an awareness going on, because if you are in an area of the United States that has a lot of dust that gets floating around in the air or anything like that, or that's just where it's mainly common, I guess, for valley fever. But if you go to the doctor and you have these symptoms, it may not be the flu or a cold. It very well could be valley fever, and I just want to make sure that you're getting treated the way that you should be, and just a correct diagnosis. So that's why I'm making this video. I'm gonna do daily vlogs about my symptoms and kind of keep you guys informed about what's going on, and just like my progress, I guess. And so at this urgent care that I went to, the one that prescribed me prednisone, they did do a flu swab or whatever up my nose, or they did a test up my nose for the flu, and it did come back negative. So that ruled out the flu. That's why I was told I had like a viral cold. That's pretty much it. And I got prescribed inhaler and prednisone. So that was the second visit to the urgent care. After that, the 20th through like the 23rd or 24th or so, that's when I had my horrible headaches lasting, like I just mentioned, about 4 days or so, just straight through, just not even Excedrin, like nothing helped me. I couldn't walk. I took off the 23rd, just another day of work, and just because the headaches were just so bad. And I woke up at 2 in the morning on the 23rd, and I called that insurance place again, or the 24/7 doctor through our insurance, and they just informed me that I should probably just go to my primary care physician and see about it, like a CT scan or something for my headaches. That same day I called the PCP and to get an appointment set up for all my issues that was going on for Monday, which was yesterday. So that was all set up, but Sunday came along, the 25th, and my symptoms actually got worse. And so I went to another urgent care. I went in with a rash, red bumps, headaches, respiratory issues, and this time the rash was on my neck and my chest instead of my back and my armpits. By this time, the prednisone did get rid of the rash in the armpits and the back, but yeah. So this time it was on my neck and my chest, and it was getting worse, and I got tested for mono, which I didn't have. I got tested for strep, which came out negative. They took a chest x-ray, and she said, she came back in the room and she said something like, "Oh, it came, your lungs look pretty clear, blah blah blah." And then she asked me if I had like asthma or something. I'm like, no. And so that was pretty much it. Then we did a blood test, and I'm supposed to get those results. Actually, I did get some of those results back today, but I'm getting more results back hopefully tomorrow. That's all from that. Then Monday came along, the 26th, and that's when Monday 26th. Oh, that's when I went to my PCP, my primary care physician, and I actually got a different rash the night before, so Sunday evening. I got a rash on my right leg, which I'll show you here shortly, but it was pretty small, a small bump in the middle of my leg, and then I only had one small, like maybe nickel-sized spot on my left knee, and so yeah, so I went to the doctor with the different rashes on my legs. I said it was kind of itchy, and by this time, the rash is gone and everything from the neck, but it's still kind of on the chest, not too much though. And I went in telling the PCP that I had joint pain, my left ankle, my right finger, my left wrist, where I had my hernia surgery, my left knee, and I had the sweats during the night. And so it's kind of interesting too, like after doing some more research, it looks like it kind of, like the fungus from the valley fever kind of attacks, I guess, where you've had like previous injuries or something, but like that's what's happening to me. So like my hernia was kind of hurting, so I was worried that, maybe I have another hernia, but my fingers, like it actually started to move from the tip of my finger. Like this was completely painful. I couldn't even do anything, but now it's like, down in the middle right here, and just all my joints and everything were hurting. So anyway, so that was that. And what they did there at the PCP, they actually did another blood sample. Well, right away she's like, "Oh, I think you have valley fever." It's like a perfect match for it, but sometimes when it's a perfect, when it looks like it's valley fever, it may not be. Lots of times even when you get your blood results back and everything, it still may say negative, even though you really do have valley fever. So that's another reason why it's really common to be misdiagnosed. So pretty much, even while I was in the doctor's office, just for like 30 minutes to an hour, it was even harder to walk, and I got more bumps on my legs and everything just from the time I was in there. And this was yesterday. So she told me, so she told me that what they would like to do is another chest x-ray, maybe from a different angle, and just make sure that it wasn't, I'm not sure if I told you yet either, but the chest x-ray, apparently I gave them the disc for the chest x-ray, and so they could take a look about what the urgent care did for me, and they actually saw a spot on my left lung. I think it's my left lung. I think it's called a nodule or something, but yeah, so they found that on the same x-ray that the first urgent care saw, but maybe I don't know, maybe they just didn't want to tell me, I don't know. But anyway, so it kind of just made more of a positive feeling for them that I did have valley fever. And so after that, she wanted me to go to a radiology group. So I did that. I went there. We got another x-ray, and it is confirmed that it wasn't my nipple in the x-ray. It was a spot on my lung, and so that all happened yesterday. And then today, yesterday she told me to call her too if it gets worse. And so today I go to work this morning, and I left after 2 hours. Just my legs hurt too bad. I couldn't walk. It's kind of hard to drive just because my ankles hurt really bad and my wrists, and so I just wanted to come back home and rest. And I called my PCP. I told her that I was more in pain. What can we do? And so they actually just started me. She prescribed me right away over the phone fluconazole, which is an antifungal medication. And so I'm supposed to be on this for a month straight, 2 tablets a day. So hopefully that will get me better in the meantime. But what we're waiting now is we did get some results back today saying that the immune disease or something like that came back negative. And then we're still actually waiting for the valley fever diagnosis, or the test results from that blood test, to come back hopefully tomorrow or the next day. But in the meantime, the only thing that I could do is, especially being on this medication, is just drink a bunch of fluids, water, and make sure I have food in my system, even though I may have loss of appetite due to this medication. And the side effects, I guess, the common side effects are just an upset stomach, diarrhea, vomiting, stuff like that. I started the medication about 7 o'clock, which was an hour and 45 minutes ago, and I haven't felt any side effects yet. I hope that it's not bad, but I don't know yet, so we'll see how it goes. With this medication, like I said, I had to be on it for a month. They said it could take over a month, a few months to a year, just depending on how bad everything is. And so yeah, I'm gonna go ahead and just show you my legs, just so you kind of see the symptoms that are visual on my body. So yeah, here we go. All right, so and also I'm using my GoPro Hero 4 Black instead of my point and shoot or my DSLR. I just figured it'd be a little bit easier to use this since it's pretty good quality for what it is, and it's just easier. And yeah, so I just hope that you're able to see everything clearly and whatnot with all the lighting. But all right, so let's see. All right, so here, that's the bump that it actually might be going down just a little bit, but that right there, it was a lot smaller the first day, and then I'm just getting, let's see here, there's a little red spot there. It's kind of hard to see it again, and I do apologize, but that's what hurts the most right now though, is the ankle. It's kind of swollen, and That right there is a huge bump. That's the right leg, obviously, and then the left leg isn't as bad, but my knee is worse on this side. So here. So there's the knee. And I started off with just this one here the night before I went to the PCP. So there's that. So I just kind of wanted you to kind of just see my symptoms, and I just hope that we figure out what this issue is. So that's pretty much all I have for now. I don't really know too much what else to say, except I'll just keep you updated about my symptoms and how I react from this medication that I just started tonight. I plan on uploading the videos that night, maybe 9 o'clock or so or whatever, just to kind of keep you updated on a daily basis and kind of go from there. I just hope that you guys, if you are having symptoms like this, if the doctors can't figure it out, even if you're not in Arizona or like New Mexico or just places that have a lot of dust, I mean, it's very well possible that you might have come to a place like this, went back home to the east, and then the doctors don't know what it is. Even the urgent cares I went to here, I mean, I had the exact symptoms, for valley fever, and I just got put off as it was a cold, like a viral cold. And as I said before, it's not a blame game or anything. I just want to raise awareness that it could be worse than what it really is, and I just hope that you guys will get the proper treatment. And I'm just glad we caught this at an early time, even though I was misdiagnosed twice with different type of medications. But we're 3 weeks into it, and there's gonna be a long road ahead of me with this whole thing. I just pray that it's gonna go well. And I mean, if you guys do pray, I ask that you pray for me, and just that I get better as fast as possible. And so just want to say thanks again for sticking with me, for your patience, even though I don't have any Rubik's Cube videos up or new ones up yet this year. But I do promise you, unless something crazy happens, I will get those up, and just kind of go from there. But as I said, I'll keep you updated. All right, guys. I hope you have a good night.